And I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy in the ways that dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like brushing your teeth is important and what's new in dental technology. We've got we've already got some questions for you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and get ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Hello there. Hi everyone, I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm very excited to be here with you all today. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. And that's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have, as you know, 4 offices in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums are healthy and strong as well. Now I'm here for you, and I would love to hear any questions you might hear. You want to hear about your teeth and gums, and you can ask your questions right here live right now, or even send them in for our next show. Your questions really help us make these shows really helpful for not just you, for everyone. And one more thing, if you like what you're learning here, please let us know. And your feedback is super important to us and to keep these, keep us going strong. And don't forget to like and subscribe to our channel so you won't miss any of our latest and greatest updates and helpful tips for your dental health. I'm so looking forward to talking with you and answering questions, and let's make our smiles the best they can be, right? Let's get started.
Let's do it.
Awesome.
Alrighty.
Awesome.
So our first question of the evening is from our YouTube channel. I'm a 37-year-old diabetic with 3 wisdom teeth already extracted. My 4th wisdom tooth hasn't erupted, and the nerve runs through the tooth. So the oral surgeon advised against removing it. Should I be concerned, or is there any risk associated with leaving it as is?
All right. So just because you're a 37-year-old, that is just because you are a diabetic. It doesn't mean that the wisdom teeth cannot be removed. Of course, it also going to depend on how closely it is associated to the nerve. That is one of the things that the oral surgeon will have to evaluate before making a decision. The best answer would be find the oral surgeon that you are comfortable with, go for a consultation. What we do as oral surgeons is when you come in here, we do a clinical exam, but also we do a CAT scan. So the CAT scan, or the 3-dimensional scan, which is going to really tell us the position of the tooth, as well as it is going to really tell us like how close it is in proximity to the nerve. And whether you are a diabetic or not, it does matter, but to an extent, we'll make sure that your diabetes is under control, and we do all the medical investigations that is necessary, and the clinical and the imaging or the x-ray investigation that is all necessary to take care of you. So the short answer to your question would be go see the oral surgeon, and they should be able to take care of it, and you should not have any concerns at all. Everything should be fine.
Perfect. Perfect. Absolutely. So if you're in the DFW area, come see us.
Absolutely. Thank you. Thank you for reminding them.
Yeah.
Yes. Thank you.
Absolutely. Doctor, my 6-year-old daughter has cavities. Should they be restored? And is a resin-based filling a good option?
Okay, so the question is the resin-based 6-year-old has cavities, and no matter what, like whether you're going to get a resin-based filling or you have some other kind of a filling, it needs to be fixed for sure. And whether a resin-based filling is a good option, absolutely, that is one of the best options. And the resin-based filling, and definitely talk to if your daughter is a 6-year-old. More than likely, you may have to go even see who we call it as a pediatric dentist or the children dentist. When you go see them, and they should be able to recommend the best type of filling that is the best option for your daughter, and they should be able to take care of it. So the short answer is go see your dentist or the pediatric dentist, and they should be able to take care of that for you.
Perfect. We'll keep it rolling. Dr. V, are dental x-rays considered safe during breastfeeding?
The answer is yes. The x-rays are totally safe during breastfeeding. As a matter of fact, the American Dental Association recently released a statement, and if you guys are familiar with the way the dental x-rays are being done, years and years and several years until like last year, we used to put the lead apron on the top of the patient over the chest, and even a thyroid collar to before started taking x-rays. Now about 6 months or like a year ago, the American Dental Association released a statement that you don't even need to put the lead apron, so because the dental x-rays are so safe. So going back to your question, it is absolutely safe whether you are even pregnant patients, right? So pregnant patients or nursing moms, it is absolutely safe for you to undergo dental x-rays and whatever the dental procedures you are going to need following the dental x-ray your dentist will be taking.
Perfect. Okay. Is it safe to use chewing gum to clean teeth and keep my breath fresh throughout the day? How many pieces per day are safe to chew?
All right. So I noticed like you asked the question, is it safe for you to use the chewing gum to clean your teeth? Chewing gum is not to clean it. The toothbrush and the mouthwash and the floss, those are the things to help clean your mouth. The one thing that you can do with the chewing gum is an additional tool. In between, like you said, your breath is to make your breath feel fresh. Can you use the chewing gum? Answer is yes. But it is not going to be a replacement for either the toothbrush or the floss to clean your teeth. So it can be used as an additional tool, but it cannot be a replacement for your toothbrush or your floss. So use the chewing gum as an additional tool, but how many times you can use it? My recommendation is maybe after each snack or maybe after each meal, depending on how many days you snack, right? If you snack too many times a day, then I would not recommend doing it every single time. My recommendation is if you are going to use it multiple times during the day or many times during the day, don't keep chewing all day. I see people chewing all day long, chewing on the gum. That's not good for your joint right here. So when you open and close, and these joints are like, it's kind of like you're walking all day long. Your knees are going to hurt you, right? The same way, these joints are going to start hurting you. So minimal to moderate is recommended 3 to 4 times a day. It's very optimal. You can go for it.
Perfect. Please brush your teeth.
Of course, yes. Please. Thank you for reminding them, right?
Absolutely. Dr. Vadivel, I'm currently undergoing root canal treatment, and it's already my 4th session. Do all root canals require this many visits? I'm really tired of so many appointments. How many more visits will it take to complete the treatment?
4 times for a root canal seems like you may have had a lot of infection, and that's one of the reasons why your dentist or the root canal specialist may be watching how the infection is going to subside. A lot of times, a lot of times nowadays, the root canal is just a one-time treatment. If you're particularly going through a 4 visits sitting, and I don't know which part of the world you are in, mostly in the US, the root canal is done one time, and that's the way things are. But I'm not sure whether you are referring to you're going back to the endodontist to get the tooth being watched before kind of like calling it the treatment is over, which is not uncommon. Even in the US, it's not uncommon. After getting the root canal completed, you're going for 1 or 2 or maybe 3 or 4 visits before we call it it is completed, you are good to go. So if you're what I would be concerned is like you got the treatment done and you went for like once or twice or three times or 4 times, and it has been like several months before prior to the treatment was initiated, then I will be concerned. Otherwise, if you are following up with your dentist or your root canal specialist or the endodontist, and then if they think that everything is going kind of smooth and then the way it is supposed to go, and you're progressing well, and then the pain is subsiding, then I think you should be good. And again, talk to your dentist or your treating dentist or the root canal specialist, and then they should be the best one to answer for you.
Absolutely perfect. I am a senior citizen dealing with sleep apnea. Can an appliance help with this condition? How long would I need to wear it?
So you're a senior citizen, you have sleep apnea, and you can definitely get the oral appliance for the sleep apnea. And how long you have to wear it? Like how long you have to wear it? Again, with without doing the complete investigation, depending on the severity of the apnea, right? So sometime on a scale of 1 to 10, if your apnea is like on a scale of 1 to 10, it's at the lower level at 1, then, well, let me kind of rephrase, right? You need an appliance for sure. That is a given. What type of an appliance depends on the severity, and most of these appliances, they need to be on throughout the night, when you sleep, pretty much, right? If you sleep during the day, do you have to wear it? Again, it depends on the apnea, the severity of the apnea. And a lot of times, to understand the severity of the apnea, we do the sleep studies, and then the sleep studies will help us determine the severity and thereby the type of appliance that you're going to need and the time that you're going to wear. And that depends on the outcome of the sleep study. Again, go with an open mind to whichever sleep specialist that you are going to be seeing, or if you are particularly seeing a dentist who is specializing in these type of oral appliance, again, go with an open mind. Talk to them what type of an appliance, what is your outcome, what type of sleep study that you're going to need, what is the outcome of the sleep study, and then what type of appliance that you're going to need. And then if you're going to, depending on the type of appliance and what is the time that you're going to wear, whether you're going to wear it during the day when you're going to sleep, or you got to wear it at nighttime. And if you're going to wear it at nighttime, do you have to wear it throughout your sleep? All of those questions should be answered depending on the type of the sleep apnea that you have.
Perfect. Well said. Absolutely. Hi, Dr. V. My wife had a severe toothache, and when I researched online, I learned about the benefits of trifoliate powder for gum health. After she started using it, her pain reduced and her bleeding gums improved. What are your thoughts on trifoliate powder as a gum specialist?
So anything that either it is natural or like some kind of a medicine that you're going to buy over the counter, and there is no evidence. And what we do here is, as periodontists or as being a dental specialist and being in dental school for over multiple years, 13 plus years, going to dental school, my dental school, and then the oral surgery school, and the periodontal school, and the dental implant school. We always practice evidence-based or research-based dentistry. So what you're talking about is some kind of a medicine that is mostly bought over the counter, and we don't have any evidence to prove that medicine is going to work or not going to work. But what I can say though is we definitely value your opinion, and we want to go with something that you believe in, and we don't want to go against your belief. So my recommendation would be get your gum disease evaluated. After you get your gum disease evaluated, find out what type of treatment that you're going to need. And if your dentist is going to recommend either doing a deep cleaning, or your dentist is going to have you come see a periodontist like me or a gum specialist like me, whether you're going to need any type of advanced gum procedure, after you complete all of that, and or depending on the level of treatment that you're going to need, you complete the treatment recommended by the dentist, and then you're going to do the trifala powder that you're talking about on the top of that, then that's what is going to be more powerful than you just taking the medicine without knowing what is the level of your gum disease. I don't think, in my opinion, it is going to work if you're going to do that just over the counter. It is kind of like, you're taking everything on your shoulder and go with it, right? I don't think it is going to work. So my recommendation would be have a honest conversation with your dentist, and then they should be able to help you.
Perfect. And what is trifala?
It is what we call it as an Ayurvedic medicine. It comes from the Eastern world, and particularly from India. So that is a natural medication, or like what we call as an Ayurvedic medication. Yeah.
Okay.
Yeah.
Very cool.
So people have the people practice like the Chinese medicine. People practice the Indian medicine, or like the Middle Eastern medicine. So whichever is popular in the part of the country they grew up, or they probably have some roots in. So it may be it is one of those medications.
Gotcha.
Over the counter, yeah.
So it's not a TikTok gimmick?
It is. My man, I wonder,
Is it on
like
TikTok?
maybe the TikTok came from that part of the world that you belong to, or you may have a relationship with, and so it is very possible, yeah. And not just the trifala powder. And speaking of the TikTok, and you're going to have like a bunch of things that you're going to come across on TikTok. And the bottom line is no DIY. But if you're going to do any type of DIY, or you're going to try something on your own, concur with your dentist, and you should be building a relationship with your dentist. Just not a matter of, we are not here to dictate, right? The dictatorship doesn't work. We are here to build a relationship. Like I said, if you are going to believe in something, then I'm going to find a way how this is going to fit the regimen that we are going to recommend, right?
Yeah. Absolutely.
So that's what we are here for.
Yeah, and that's what we look for in providers. Absolutely. Doctor, can extra teeth grow at any age? How can I be cautious about this?
So, can the extra tooth grow at any age? The short answer is no. Unless you are growing, and let's say you are 35 years old, we all go horizontally, right? We don't go vertically. We all know that. So if you are growing vertically, then we got a problem, right? So if you are going vertically, then I can agree your tooth may be growing, which doesn't happen. So the teeth stop growing at the age of between 15 to 17. 15 for females, and then 17 for men. That's when the teeth stop growing. So beyond that, the teeth do not grow. But what might happen is, for example, this is one of the most common things that I see in my practice on the wisdom teeth. You may have a gum covering on the wisdom tooth, but what happens is over a period of time, then you start to have a lot of infection. So the gum tissue is going to start to have infection. Now the gum tissue is going to start to erode away. Now you feel like, now you're able to feel the tooth, and the tooth is growing in. The tooth is not growing in. Rather, you're losing the gum, or you're losing the bone, and that's what is going to make you feel like now the tooth is growing. Sometimes we see the impacted teeth. The teeth got stuck under the gum in the roof of the mouth, or maybe another baby tooth right here that got stuck under, like you still have a baby tooth that is starting to show through. Now all of these are happening because you're losing some bone or losing some gum around those impacted or like a non-showing teeth. So get it checked out so you're not growing, and it is impossible for us to grow after the age 15 or 17. More than likely you have something going on. If you feel like the tooth is showing through, or you feel like the tooth is growing, get it checked out with the dentist.
Perfect. Okay. So we're going to spice things up now with a live question.
Oh, great.
Yeah.
All right. Let me see too. Yeah. Okay.
Okay.
Yeah. Awesome. Yeah.
Here we go. So I use Crest Pro Health Advanced Deep Cleaning Rinse daily. Is this okay, doctor?
Absolutely. Yeah. So Crest Pro Health is one of the mouthwashes that we recommend here. The difference between I'm assuming that you probably read something about the Crest Pro Health, and that's the reason why you may be asking. There are two types of mouthwashes. One, we have an alcohol-based mouthwash, and then the non-alcohol-based mouthwashes. Some people, when they use the mouthwash and they feel the freshness or the burning that you get from the alcohol type mouthwash, and then people, they love it. And if you're kind of one of those person, then that's great. But if you're not one of those kind of person, if you don't like the burning as much, and that is possibly one of the reasons, or if you are looking for some kind of a non-alcoholic based mouthwashes, and that's one of the reasons why you might have picked the Crest Pro Health. And if you did that for any reason, or if you did that just for you like it, or you did it for a reason, no matter what, go for it. And as you might have already heard, like from this show here, I want you to use the mouthwash on the top of your brushing and the flossing. If you are going to think that it is a replacement for the brushing or the flossing, Crest Pro Health is not going to work. It's not going to cut the deal. But if you are going to use it on the top of your brushing and flossing, and now Crest Pro Health, go for it. Great for you. Good for you.
Yes. Yeah. And again, please brush your teeth.
Thank you for reminding them again. Thank
yes,
you.
Please.
Yeah.
Okay, so we'll get back to live questions in a moment. But getting into our viewers sent in, we have, how is pain-free dentistry different from regular dentistry? Are there different types of sedation, and how can I choose the right one?
All right, so pain-free dentistry works in different ways. So if you are particularly referring to the sedation, I'll come to that in just a moment. But pain-free dentistry can work in three different ways. One, anesthesia-free, meaning anytime you are going to get some kind of a dental work done, we gotta, most of the time we gotta give you anesthesia. So anesthesia, like even from the slightest injection, you may be thinking it may be pain, because a lot of the reason, many times patients are dreaded just about the injection they are going to receive in the mouth, and particularly one in where?
The upper?
Yeah, the roof of the mouth, right there. Mm-hmm. Right here. So
they all hurt though.
Yeah, they all hurt, but this one patients complain the most, which is the roof of the mouth right here. This is the roof of the mouth on the inside. Right there. It hurts the most, and patients don't like it at all. So if you're dreaded about the injection, and sometime what we do is to avoid the injection, we can do laser dentistry, for example. Laser dentistry, sometime you don't have to give any numbing at all, and you can actually cut the tooth, and you can do that without the anesthesia. So if you're referring to no anesthesia dentistry, it may be called a pain-free dentistry. If you're referring to the laser dentistry, and that may be considered sometime as a pain-free dentistry also. Going back to the third one that you mentioned, which is the sedation. So what that means is, before you receive the injection, you are going to be put to sleep, which is what we do in our office, right? All the time. So we put patients to sleep, and putting patients to sleep can work in multiple ways. So one, we call it as an oral sedation. You take a pill, then you go to sleep, or we put the patients to with IV sedation. giving you oral sedation means like absolutely no injections whatsoever at all, and you go to sleep or you lose some kind of a memory, and then once you go to sleep, then we give you the injection which you're not going to ever remember. That will become a pain-free dentistry. And then speaking of the IV sedation, you still have just one needle, just like this. If you have good vein like me, then it's going to be very, very easy. And if you don't have a good vein, and sometimes you may if you are not being told by the provider or the dental office, drink a lot of water. I always tell my patient a lot of drinking and peeing, right? A lot of drinking and peeing. Get gallons of water to keep drinking until 2 hours prior. The clear water is okay. You cannot eat or drink for about 8 hours prior to the procedure anytime you're doing oral or IV sedation, but you can drink clear water up to 2 hours. But anyway, so once you have come to our office and then we put you to sleep, then it totally becomes pain-free. So speaking of the pain-free, multiple options: no anesthesia, no local anesthesia, no injection, laser dentistry, or putting you to sleep via oral sedation or IV sedation.
Perfect. Yes, and clear water only when
You
you're
got
getting
it.
sedation.
Absolutely.
Nothing else.
Yeah.
Alrighty, doc. I've been using full dentures for the past month, but I experience a vomiting sensation whenever I try to chew solid food. I often end up removing my dentures because I can't enjoy my meals. How can I avoid nausea if I opt for implants followed by dentures? Will the issue persist?
Great questions. One of the most common reasons why patients get dental implants is because they cannot enjoy their meal, and then they get this nauseated feeling. So part of the reason why you're going to get that nauseated feeling is because this is the lower denture, for example. See, such a bulky teeth, right? And then on the top denture, not only that you're going to have those bulky teeth, but also you're going to have the palate covered right here. This one is an implant set of teeth, so that's why you don't have the palate covered. But on the ones with the one that you're talking about, the regular denture, you're going to have that palate covered also. Part of the reason why you feel nauseated or you feel like vomiting, because you're going to have the complete palate that is covering right here. So anytime you do that, most patients say like they are gagging. The moment you put in, like they are going to gag and they're going to throw up. They go, right? So that's what they do. So that is one of the most common problem with the denture. So speaking of that, and what is the solution is to get dental implant, which you already mentioned. If your dentist already recommended, for that reason, absolutely, that is one of the most common reasons patients cannot tolerate dentures, and now they got to get dental implants. When you do the dental implant, again, you got two options. One, either you can get these removable denture, which are like a slightly pocket friendly or a budget option, as opposed to you can get a complete set of teeth, which are going to be like completely fixed. You don't even need to remove them. They are not as bulky as this, but you can get completely fixed teeth, and that is an option. And if you happen to be in the Dallas-Fort Worth area,
come and see us.
There we go. You got it.
Absolutely.
All right. Perfect. Yeah.
Yep. And your implant dentures typically function as natural teeth, right?
Absolutely. Oh, yeah. So speaking of that, the implants, the part of the reason why patients want to get dental implant, they look, feel, and function like a natural teeth.
That's right. Absolutely.
Yeah.
So now we're going to amp up the fun quite a bit with the game. Are we ready for our favorite segment?
Mm-hmm.
Yeah.
Absolutely. Yes.
Okay,
yeah.
so we're going to do rapid fire. I'm going to give him 3 questions that he has to answer under 30 seconds within 1 to 2 sentences.
All right. Only 3 questions?
Only 3.
All right.
Yep.
Okay. I
So
thought
make
you
it
said
count.
you're going to 5, you said.
Oh, you're right. Oh, okay, I can't count. Sorry. Okay.
Okay.
Yeah,
All
it's
right.
fine.
Okay. All right, okay.
Okay, let's
Because
go.
I remember you telling me like you got 5 rapid fire questions. Now you said 3.
Oh.
I
Maybe
know
I was giving you some more time.
Are you getting amnesia? You didn't even get IV sedation.
I
Are
might have.
getting
You don't know what I
amnesia?
do in the operatories.
Oh,
when I'm in
yeah.
there hanging out.
Man. Yeah.
We never know. But are we ready? I think he's stalling. Are you ready?
I'm ready, man.
Okay.
I'm being ready.
All right. Number 1. Is it okay to use a sewing thread for flossing?
Sewing thread for flossing, and if you're not going to do flossing at all, I would say probably say yes, but make sure that if you're going to do it, like it's just going to break and it's just going to stuck. The answer is no. Yeah.
No. Okay. Can I use whitening strips every week?
You can definitely use it every week. Absolutely yes.
Okay. My toothbrush looks worn out, and after just 2 months, why does it wear out so quickly?
You're not supposed to use more than 2 months if you are using, and it is very easy to replace. Don't use it after 2 months. Throw it away and get a new one.
Throw it away. C. Does an impacted wisdom tooth always require surgical removal?
Not always a surgical removal. Sometimes it could be as simple as a 2-second pop.
And it's out. Depends on
It
your
is
doctor.
out. Depends on
Oh, okay.
Thank you. Thank you for reminding. Yes, yeah.
Absolutely. Stanius fluoride or sodium fluoride? Which is good for oral health?
Both of them are good for oral health, and again depends on the condition. Check with your dentist.
Stanius fluoride.
Stannous fluoride, yeah. Uh-huh.
Expand. What is that?
It is so stannous fluoride is one of the chemicals, or sodium fluoride is another one of the chemicals. So if you guys look at the back of the toothpaste tube, it is going to be written back there, like whether your toothpaste has stannous fluoride or sodium fluoride. Stannous fluoride, sometimes we give it for sensitivity. Sodium fluoride, we give it for a different reason. So again, I check with your dentist and see what is the best option.
Okay, that was a bonus question. Alrighty, good job.
Okay.
I think you did it.
So you gave me a bonus
I gave
question
you a bonus
to test
question.
me, huh?
Just wondering. You never
Okay.
know. 13 years of school. We just had to make sure he still had it.
Okay.
All right.
Okay.
Okay, back to our viewers' questions. I visit the dentist regularly for a dentist cleaning every year, but each time I feel a gap between my teeth afterwards. Is it common to experience this after a cleaning? Could it be a side effect of the procedure?
I'm not sure, like the gap that you are referring to, and particularly it's not an uncommon thing to happen, and so patient, and as you guys know, I treat gum disease all day long, and I've been doing this for the last like about almost 20 plus years, or 3 decades, I should say, the treating gum disease. So what happens is when you have gum disease and your gums are all kind of swollen, right? Imagine, if you had like a big boo-boo and your gum, your skin is all swollen. When the swelling goes away, then you're going to become really flat, right? Or like if you have like a really gaping wound and you kind of did something to the skin and you got like it is really bad here, then you're going to even have a dent in the skin or the bone here, right? The same way. When you have gum disease, particularly advanced, moderate to severe gum disease, your gum tissue is going to be all swollen and it is red, puffy, bleeding, and you got like a lot of tartar under the gum line, and then your dentist has to give you numbing and go under all the way to remove all the tartar and the plaque and the bacteria and the inflamed gum tissue and the infected gum tissue and all of that. So now when that all happens, it's just like your skin when it heals, and it is just going to look fresh, but it's going to shrink the same way. Your gum tissue is going to shrink. And because you already lost the bone under the gum tissue where the infected gum tissue is, now your gum tissue is going to shrink. So guess what? Now you're going to feel like, oh, your dentist created the gaps in between the teeth, right? It's not we created the gap. It is because you lost the bone, and you would be continuing to lose the bone had you not come to see us, and we stopped it. But unfortunately, you got a little bit of a gap. But guess what? Like sometimes when patients have advanced gum disease and they already have a bit of a gap, and now I'm going to tell them, hey, you may feel like I'm going to increase the gap in between your teeth. It's not because I want to, but there is no other way. That's unfortunately the beauty of the beast and the way to treat the gum disease and to train the dragon, right? So we are going to create the gap even bigger, but in a good way that we want to help you keep your teeth. So you should be happy that you probably have some gaps in between the teeth, but as dentists, we did it for a reason.
And keep going.
Keep going, right? Don't quit. Yeah, don't quit. going, and you need to continue going, particularly what you're talking about is the periodontal disease or the gum disease. You should be really seeing your dentist or the periodontist every 3 months to keep your teeth for the rest of your life.
That's right. Alrighty. Hello. Whenever I try to chew food, no matter how slowly, I end up accidentally biting my cheek. My jaw seems to slip, especially during winter. Is there anything that can help me enjoy food without worrying about biting my cheeks?
So, when your teeth are slipping or when your jaw is slipping, it is not uncommon. You may have what we call it as a TMJ issue, meaning like the temporomandibular joint or a temporomandibular disorder which is what you might have. That is what I'm assuming, that because see here, your teeth are supposed to go like that. When your teeth are like, whenever you're biting, whenever you're doing this, and if your jaw is slipping, that means like when you're opening or when you're moving, your jaw is slipping. Now it is going to make you bite your cheek like that. So the real answer to the short answer to your question is whether you have TMJ or the TMD, get it checked out. And if it is because that you grind your teeth, and which is what is making your TMD or your TMJ worse, and talk to your dentist about making a night guard. So what we call it as a night coverage or a night guard. It looks like this. See here? This is a night guard. It's pretty heavy, it's just not going to break, and you wear this in between the teeth like this. You put it either at the bottom, bite it down, or you put it on the top, you slip it in and you bite it down, and this will help you avoid the cheek biting also, because once you cover the top or the bottom teeth, you won't be able to grind your teeth together, right? So that is going to help you also. So this is going to solve two purposes: one, to help you prevent from grinding your teeth, and also to help you prevent from biting onto your cheek as well.
Absolutely. Mm-hmm. By any chance, can wisdom teeth cause biting the cheek?
Well, that's a great thought. Absolutely. So anytime when you have wisdom teeth, and what Shai is trying to say is anytime you have wisdom teeth like on the right in the back, and when you have a lot of inflammation around the wisdom tooth, when the gum tissue is starting to grow around the wisdom tooth, and people feel like, hey, I'm biting my cheek. It is not actually the cheek, but it is the extra gum tissue because of the infection and the inflammation that is growing around the wisdom tooth is causing the gum to be swollen or growing, which you may be biting at the time when you chew. So again, great thought. So make sure to check with your dentist whether you have wisdom tooth growing.
Absolutely.
Man, finally,
I can do something. I attribute to something.
Thank you. Yeah.
Absolutely.
Do you know what we call this in the AI age we live in?
Chat GPT?
No. But Chat GPT, Chat GPT, yeah. But the answer is, we call it as a prompt engineering.
Oh.
So to use the AI, mm-hmm. and if you use the AI, which could lead into give different results, as opposed to if I'm using it, it may be given different results, because you may be giving a different prompt to the AI, and I may be giving a different prompt to the AI. So prompt engineering is a big field. So we are using a lot of AI. Speaking of AI, in dentistry, and then I use a lot of AI in my field also. And it's all about the prompt engineering. Depending on who's a good prompter is the AI is going to give the best answer. And so thank you for being the prompter today.
Absolutely. Any doctors on, come check out our study club. This was something you talked about.
Right, absolutely.
Integrating AI into dentistry. So definitely tune in. Alrighty. So we appreciate all the live comments. We're actually going to jump in and interact with you guys a little bit and see what You guys are asking us. You ready for a live question?
Oh, okay.
All right, let's put them on the spot.
Okay.
Okay, I notice my gums bleed whenever I floss. Is it possible to damage them by flossing too hard?
You're not going to do any damage. I shouldn't say any damage. You're not going to damage teeth to the degree that you're going to start hurting, or you're going to make the tooth fall out. Of course, the worst thing that I see are the most severe. I shouldn't say not the worst, right? Most severe is when you floss, and then I see people they are being a little bit aggressive, and I see like a floss cut. It's almost like when you're handling a piece of paper, then you're going to get a paper cut, right? That's what is going to happen. Similar to that, then you may get a floss cut. But other than that, I don't see like any kind of a damage that you might end up doing by doing the flossing. But if you at all you're doing, like, man, it's very, very minuscule of a damage that you may be doing, or almost no damage. So the benefits completely 100%, 99.99999% outweigh the risk of using a floss. So if you're staying away from flossing just because for that reason, absolutely, there is no excuse. Excuse is an excuse to stay away from the flossing,
right?
But not this. So don't stay away from the flossing. Go for it.
Yes, floss, brush, and floss.
You got
daily.
it. You got it. Twice a day.
Twice a day.
Twice a day.
But
yeah.
please, at least once, please.
Yeah.
Absolutely. My son is fascinated. So we'll jump back into live questions. So still send them in, but we'll get back into our viewers sent in questions. My son is fascinated by having long canines for school costume events, annual plays, or Halloween. Is there a safe way to achieve this look without harming his teeth? Well, that's a parent that's supportive.
Yeah. You man, like, I would not recommend, like, if you are going to do something to having like a long canine. If you're really trying to do something like just for like a school event, maybe like get like a grill or something, or like a vampire tooth or something. Speaking of that, a patient of mine brought this today, like a grill. You guys can see right there. They were asking, oh, is it safe for me to wear? And then we were just discussing, and I just happened to have it on my desk, and I kept it there. So I'm showing it to you. But so it is not good for you to wear it as a long term. So going back to your question about, if you're fascinated about having a long canine, just wear like a veneer. We call it as a veneer, or like a
prosthetic.
Like a vampire tooth. You're going to wear it like almost like it is like the same grill that I'm showing you, but it is just like made of white material, right? A plastic material. You can wear it like temporarily for the school event. It's almost like Halloween. People wear all kind of like vampire teeth, just temporarily, right? And if you want to really make it naturally looking, can you talk to your dentist about having them make it a little bit fancier and then make it fit really good? Yeah, you can do that. But if you're to the degree that you're so fascinated about having a vampire tooth all along your life, can a dentist make a tooth like a vampire tooth possible? Yeah, it depends on what you want in your life, right? So answer to your question is yes, it is possible. I would not recommend doing it permanently, but to do it temporarily, you got multiple options. You can either buy some over-the-counter vampire teeth temporarily, or talk to your dentist and they should be able to do it for you.
So you just randomly had a patient's grill sitting on your desk.
That's right. I actually have two of them right here. See?
A patient's grill.
A patient's grill, yeah.
Patience.
Sometime I do, sometime. If you guys are watching our TikTok videos, and we have a great TikTok show, and then we got a YouTube Shorts show, and nowadays, patients are throwing me with all sort of questions. Even here, you guys throwing me to like all sort of questions, and a lot of patients ask me questions about the grill and about these grills, and I've been thinking of a lot of cool ideas about making you guys, and we call it funtainment, right? and we call with the sorry, edumate. You know what that means is education plus entertainment together. So we want to make it entertaining as well as make it educational. So keep watching our TikTok and keep following us on TikTok and our YouTube Shorts video. You're gonna see a lot of those fun videos. And she comes and actually looks at my desk and then, Doc, what are you doing? Mm-hmm. Right?
Yeah. Have you ever worn a grill before?
Yeah.
Oh.
Yeah. You're gonna see some videos coming pretty
All
soon.
right. Absolutely. As he randomly has a patience grill.
Don't post those crazy pictures you take of me. Okay. Anyway. Okay.
We post them in the group chat.
Oh
sent
yeah.
it to the
Yeah.
team.
Internal is good. Yeah. No external, man.
Yeah. Not yet, at least.
Yeah.
Absolutely. We won't spoil it for you guys.
No secret, guys. It just saw like, at some point I was talking to my team about, hey, at some point we are going to do some, the behind the scenes event, right? So we are going to post some behind the scenes too. So
Stay
we'll
tuned.
post those on the behind the scenes.
Yes,
yeah.
we will. Absolutely. You guys send your questions in, but before we jump into the comments, hi doctor, I had my lower back first molar removed 11 years ago, and now the extraction gap has reduced. My doctor says a regular implant cannot be placed. Can mini implants be an option if regular implants are not possible?
Man, anything is possible in this world, so there are multiple options. And so what the person is referring to is, see, when you have two teeth like this and you are supposed to have, after you get the tooth removed, the gap is supposed to be there. But if you do not replace the tooth, what's going to happen is either the top tooth is going to grow into the space or the two teeth are going to move towards each other. Now the gap seems to, like, instead of a gap like this, and then now the gap is going to get smaller. So either we place a smaller diameter implant instead of this diameter, then we may use like a smaller one, or we may place a mini implant. And so the answer is, again, talk to the dentist, and we do a variety of things that we do. We do what we call it as a clinical exam to look in your mouth, and then we also do like an imaging using a CAT scan. Depending on the outcome of the clinical exam and the imaging, we can decide what kind of an implant you need and what size of an implant need, whether you're going to need a regular implant or a mini implant. The bottom line is to help restore your teeth to function, and so you can continue to enjoy and function like the way you should normally do. And like we said earlier, look, feel, and function like a natural person.
That's right.
Using dental implants.
Mm-hmm. Come see us if you want more options.
Absolutely. If you're in Dallas, come see us. Go ToothHQ.
Go ToothHQ.
You got it.
Mm-hmm.
Yeah.
Alrighty, so we'll jump back in the comments and put Doctor back on the spot. You ready?
What do you mean? Like you're going to put me on a spot?
You're not prepared for this. You don't know what's going on.
Well, okay.
Yeah.
I got it. I'm going to read it. Look, I'm going to cheat. Well,
okay, you're going to think about it? Okay. When I opted for a silver filling, my dentist mentioned it might affect my MRI readings because I have muscular dystrophy. If I choose to get an implant instead, will it also interfere with my MRI reading?
So this is not an uncommon question at all. I'm glad like you are thinking. So either the silver fillings or the implants, they are not going to affect MRI to the degree that you may be overthinking. But is that going to scatter the MRI? It is very possible. There is there's always some kind of scattering. Either it happens from the silver fillings, or sometimes you have some type of metal on the back of your neck, and all of those things can happen, do some kind of a scattering. So it is completely okay for you to get either metal fillings, or completely okay for you to get dental implant. That is not going to affect anything as far as getting the MRI done. Although you may feel, or not you are going to feel, your radiologist is going to see some kind of a scattering, but it is not going to affect the MRI to the degree that it is going to be non-diagnostic. So it is okay. The short answer is, yeah.
Perfect. Absolutely. Alrighty. Thank you guys for sending in your questions.
So did I do well?
I think you did well. I think you kind of maybe read ahead before you read ahead.
Oh, really?
Yeah, I think he's reading them.
Do you know how many times I've answered this question in my entire life?
Right now.
Oh my! Give me a break. Give me a break.
Right now.
Okay. All right.
Absolutely. Alrighty, you guys. Hi, doctor. Which type of crown is better for a posterior tooth implant, zirconium or metal ceramic?
The back teeth, as you know, it's a functional teeth. They need they are there for chewing. So one of the reasons why we do let me back up a second maybe here. So anytime you do implant, there are two types, two things that go on the top of the implant. Implant, of course, they go underneath into the bone, and then after they go into the bone, then you have two things that go on the top of the implant, which is what we call it as an abutment right here, which is goes over on the top. I don't know how well you guys can see right there. See that right there? Yeah. And this is the bone, this is the implant, which is completely under, and then this is the abutment, and this is the crown. So the crown nowadays, it's for the most part like 99, or maybe I should say 100%, it is made of zirconium, the crown that goes on the top of that. However, the abutment that goes on the top of the implant, depending on the site of the tooth, whether it is a front tooth or on the back tooth. In your case, you said it is a back tooth, so I'm going to pretty much say that your dentist more than likely will be making a titanium abutment, which is what I would recommend. So the implant followed by the titanium abutment on the top, and then a zirconium crown if it is a back tooth, which is your case. But just to kind of add on the top to answer your question, in case if you ever end up going to need an anterior implant or a front tooth implant, your dentist may recommend the titanium implant followed by a zirconium abutment and a zirconium crown, which is completely okay also. So the answer to your question is back teeth implant followed by the titanium abutment, which is the metal abutment, followed by the zirconium crown. On the front tooth, either you can do a metal abutment, which is the titanium abutment followed by the zirconium crown, or your dentist may recommend a zirconium abutment followed by a zirconium crown, which is completely okay also.
Perfect. All right. Again, come see us for your options.
Absolutely. Yes. Thank you.
Absolutely. Hi, Dr. V. I'm 22 years old, and recently one of my front teeth started shaking. Worried, I visit a dentist who told me it's a milk tooth that is dead and cannot be treated with a root canal, which also explains why its color is different from my other teeth. However, while having it removed, I experienced pain. If the tooth is dead, why am I feeling pain?
Great question. So this is not an uncommon question. Again, many people ask, hey, I thought I had a root canal done, and why am I still hurting? My nerve is supposed to be gone, right? And my tooth is dead, which means like the nerve is dead. Why am I still having pain? My baby tooth, the nerve should have been gone a long time ago. Why am I still hurting? So although you may have the nerve that is gone, now you got like a lot of bacteria. Part of the reason why you are having discomfort is by those bacteria traveling into the bloodstream, and then they are getting into the bone, they are getting into the gum and affecting your gum and the bone surrounding, which is going to cause infection and the inflammation, which is what is going to cause the pain around the tooth. When you have infection and the pain and the inflammation, whenever you are getting numbed, and meaning like whenever you are getting a numbing injection from us dentists, the numbing medicine is not going to completely work, and the numbing medication is going to be neutralized by the infection, which is acidic, and the alkaline, the anesthetic, they are going to get neutralized. So now the numbing medication is not going to work as well. So it is very possible the reason that you are having pain during the extraction is because of the previous infection and the inflammation that you had on the site, and very possible at that time the numbing medication was not working to the degree that we wanted to work, and that's the reason why you are having pain.
Okay.
Yeah.
Inquiring minds want to know, what is a milk tooth?
Say again?
What is a milk tooth?
Oh, milk tooth. Oh, okay. Sorry if I did not say that. So milk tooth is a baby tooth, pretty much.
Oh.
Milk tooth, like, yeah. Some cultures and some some ethnic people, they used to call or they still call the baby teeth. We say right here in America, we normally say baby teeth, right?
Mm-hmm.
So baby teeth, they call it as a milk teeth. You know why they call it milk teeth?
Because babies drink milk.
You got it, man.
Well, I was thinking milk rot.
Oh,
right?
okay.
Doesn't that cause like teeth decay
Yeah,
for little ones?
Yeah, correct. Yeah. So do you know why it happens?
Because they let them go to sleep with their bottles.
And do what? And then in some of the like ethnic people, it's not uncommon. And in here in America, we don't add sugar to the milk, right? Mm-hmm. But in some of the ethnic people, they add sugar to the milk, and before they give the kids the milk, the babies. Mm-hmm. So when they they sleep in with the milk itself, it is going to cause decay. But on the top of that, when you put sugar, and then when they sip on the milk like all night along, guess what?
Milk
the cavity, there we go.
Okay.
So it's just going to make it even worse, like 10 times worse or 5 times worse. Because of the sugar. So no milk sipping, or don't give the baby the milk, right? Yeah. Mm-hmm. Particularly like little older ones, of course, with the tiny babies, and it's okay. But so there is a way you can avoid that. That would be great. Yeah.
Absolutely.
As they get older, try to wean away from the bottled milk as much as you can.
That's right. Yeah. Parenting 101 dentist version.
Mm-hmm.
There we go.
You got it, man. All right.
Alrighty. Hi, Dr. V. Why can't teeth heal like other body structures? Is there any possibility of inventing a medicine that could heal tooth decay and disease? How successful are filling materials placed in cavities? Do they actually repair the cavities? And can they be removed after a few years if the tooth heals?
So the short answer is no is the answer. We really wish somebody could invent medicine to completely heal the cavities, and either instead of doing any type of filling, you give the medicine, it goes away, or after you put the filling in and you put the medicine or the filling in, and then you heal it, you remove it, and then the tooth is going to heal. It is not going to happen. I do not see that coming anytime soon at all. There is so much of invention that is going on, including, we live in this AI world that we were talking earlier. There is so much happening on the artificial intelligence side. I do not see this topic happening, and there is so much things happening that are going to be on the preventive side. And then there is also going to be on the treatment side as far as the medicine. But this one that you're talking about, we are going to give you a medicine to heal your cavity, or we are going to give you a medicine to remove the filling and let your tooth heal. I do not see that coming. However, I know of some literature, people are trying to see whether they can treat a specific type of bacteria that are causing the cavities, and the medicine or the vaccine that they are going to give, it is going to prevent the cavities. And there has been some research going on for the longest time, but I have not seen that into fruition, and it has not been practiced in dentistry yet. But I'm hoping that it is going to come, and which we have been talking about for the longest time that I can think of. Ever since I was in dental school, this was back in 1930. 1930. Are you kidding me? I hope I'm hiding my gray hair right here.
Just joking.
1993, ma'am. Sorry.
All right.
Yeah.
I wasn't even born yet.
Oh. All right.
I'm just joking.
Are you guys trying to say that you're younger than what you think?
I am younger than what you think.
Okay. All right. No, we're not talking about age here. Sorry. I'm not talking about my age, and I'm not talking about your age either.
Oh, okay.
Yeah. I know you're going to say you're sweet 16.
I'm like 21.
21.
Yeah,
okay.
you do. Yeah.
Okay. I believe you. All right. I believe you. I saw your nose going bigger.
Hey, I'm not lying.
I saw your nose growing bigger.
No, I didn't.
Yeah, it did. Like when you said 21. Yeah.
I'm 21.
Yeah.
Anyways, TikTok said that you can heal cavities, doctor. They say you can do oil pulling.
I'm not making those TikTok links. But if you're going to do, again, speaking of the oil pulling, right? Like, there is already like a video that we have done several times, and there has actually been questions on the same YouTube channel that you're watching about oil pulling. So going back to what we were talking earlier, if you're doing the brushing, flossing, and then your mouthwash, and then if you're going to do the oil pulling on the top of that, I get it. But if you're going to think that your oil pulling is a replacement for the brushing or flossing, it's not going to cut the deal. And if you're thinking that the oil pulling is a treatment for your gum disease and you never have to visit the dentist, that's not it. Or if you've been told that you have gum disease and you need to have treatment done, that's what your dentist or the periodontist told you. Now you're going to think that oil pulling is a replacement for that. No, that's not going to do it. And that's what one of the things I get asked, or that's what some of the TikTok people that I'm hearing, that don't believe in your dentist and just do the oil pulling, you're going to be okay. Sorry.
That's right. Check out our TikTok.
You got it. Mm-hmm. You got it. Yeah.
We had way too much fun,
TikTok.
Doctor.
Yeah, we are going to have. If you thought it is fun, but we're going to have a lot more fun. Yeah. Mm-hmm. Okay.
Yeah.
Thank you for being a great show. Thank you, guys, and then we look forward to seeing you guys next time. Thank you very much.